Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Chronic pancreatitis as well as the pancreatic exocrine insufficiency. We are looking at the TIGAR O classification system. So under this, the first one is the toxic metabolic. So the heading is toxic metabolic. So toxic metabolic, it includes there is alcoholic and there is also the tobacco smoking. Tobacco smoke. Next is there is presence of the hypercalcemia. Hypercalcemia as well as the hyperlipidemia. So both are hypercalcemia and the hyperlipidemia. Next, there is a CRF. CRF stands for the chronic renal failure. Then medications. Medications include the phenacetin abuse. There is a phenacetin abuse. Next is it includes the toxin compounds. To be specific, is a toxin. That is the organotin compounds. Organotin compounds. So this includes, what is the example? It includes the dibutylene dichloride, as well as the DBTC. Next we move on to the idiopathic. So idiopathic, it includes there is a early onset. So there is early, there is late, as well as there is tropical. So there is early, late, as well as the tropical. Now let's move on to the genetic. So under genetic, there is the cationic trypsinogen. Cationic trypsinogen. So cationic trypsinogen, it is PRSS1. Next is the cystic fibrosis transmembrane. Cystic fibrosis transmembrane. This is the conductance regulator gene. The conductance regulator gene. So it is known as a CFTR. Then comes the calcium. So there is a calcium sensing receptor. So calcium sensing receptor. This is nothing but the CASR. Next is the chymotrypsin. There is chymotrypsin. So chymotrypsin C gene. So this is nothing but the CTRC, the chymotrypsin C gene. Lastly, there is a pancreatic sense. There is a pancreatic secretory trypsin. There is a pancreatic secretory trypsin inhibitor gene. So this is in short known as the SPINK1. This is a SPINK1. So we saw the PRSS1, CFTR, then the CASR, then the CTRC, and the SPINK1. Next, the heading is going to be the autoimmune. So autoimmune, it includes the type 1. So it is T1. This is the autoimmune chronic pancreatitis. This is autoimmune chronic pancreatitis. Next is the IgG4. There is IgG4, which is systemic, and there is also the type 2. The type 2 autoimmune chronic pancreatitis. So it's autoimmune chronic pancreatitis. Now let's look at the recurrent and severe acute pancreatitis. So the recurrent or the severe acute pancreatitis. So this includes the post-necrotic. So there is post-necrotic, that is nothing but the severe acute pancreatitis, and there is also the recurrent acute pancreatitis, recurrent acute pancreatitis. Next is the vascular disease, or the ischemia. So there's vascular disease or ischemia. Lastly, it includes the radiation induced. It can be radiation induced. So there's post-necrotic, recurrent acute pancreatitis, vascular disease and ischemia, and the radiation induced. Lastly, we are looking at the obstructive. So under obstructive, there is a pancreatic division. There's a pancreatic division, and there is also a duct obstruction. That is example being the tumor. Next is there's a periampullary duodenal wall cyst. There's a periampullary duodenal wall cyst. And lastly, there is a post-traumatic pancreatic duct scars. There's a post-traumatic pancreatic duct scars. To learn and grow daily like this, please do subscribe.